Expert. So, Stephanie, it's something you don't necessarily want to think about, but it's something that you should think about. You know, what if, say, you get sick, something happens, you no longer have the power to decide for yourself what you want to do with your affairs. It's something that people should think about.
Absolutely, and you're right. No one wants to think about it.
Yeah.
I don't like thinking about it, and this is my
Who
business.
does, right?
It stresses me out.
It's a sad thought, but it's important to prepare.
Absolutely, and we have to think about if we're unable, incapacitated, let's say, and unable to make decisions for ourselves, who is our voice? Who is going to speak with those healthcare professionals? Who is going to manage our money, pay our bills? We have to choose that person in advance and really put those wishes in writing.
So, I mean, when is the right time to start thinking about this and getting things in order?
I think early. I think for sure once you have children, a lot of people start thinking about that because they think about who's going to care for my kids if I die. But it's not about if I die, it's about if I'm ill now, and I'm still alive. I mean, I know that I did my legal documents probably when I was about 30.
No kidding.
Yeah, because, well, this is my field and I can see what happens, because you have to think there's also accidents, right? So you could be in your 20s and something can happen. So you really want to think well in advance.
So, I mean, say you haven't done this, something happens to you. I mean, what's sort of the worst case scenario here? Like, you could have infighting in your family, and like, can you just sort of describe what could happen?
Well, in my clinical practice, it's family fighting and conflict that I see the most. And what happens is that, let's just take a senior, for example, who has dementia.
Sure.
So now my mom has dementia. Now what are my sister and I going to do? Who's going to make the decision? Well, maybe she wants to do one thing, I want to do something else. Maybe she's not trusting me in the way I'm managing my money. And all of this conflict ensues, and then the person who's left without their wishes being followed through with is our mother, because we're too busy fighting.
Yeah, and then, of course, at that point, she doesn't have the capacity to step in and moderate that situation. And so what exactly should people do? What's the advice? You call up, like, how do you do this?
Well, I say go to a notary. You don't have to. You can actually, on the public curator site in Quebec, you can actually find documents and sign them with witnesses. The thing with that is that once you want to activate those documents, you have to kind of go find those witnesses and get proof that they actually did witness. So I say go notarial, go see a notary, and the documents are very easy to do, and it's actually not that expensive.
Oh, okay, that's good.
Yeah.
So if you do this, you have all of your stuff prepared in case of anything happening. I mean, what's the best case scenario? We talked about family infighting. If you do this properly, what happens?
The best case scenario is I'm ill, I can no longer speak for myself. All of my wishes are in writing. Let's say I don't want tube feeding. Let's say I don't want to be resuscitated. It's all there. It's all clear. I'm ill. My family knows what to do. They're not doubting themselves. They're not feeling guilty about their decision because I was very clear. My wishes are respected and followed, and the family is happier.
Great advice.
Yeah.
Stephanie Erickson, she's a social worker, family caregiving expert. Like I said, something nobody wants to think about, but you could start thinking about it even in your 20s and 30s. It's very important.
Today,
no matter who you are.
Yeah.
Thank you very much,
You're
Stephanie.
welcome.